let's talk a little bit about some pictures of acne therapy patient results. Now, we have a policy in my office where we don't release our own patients, but I previewed these myself to make sure that they were consistent with the results that I was getting. And here on the left, you're going to see what I talked about before with some of this, I would call this moderate to severe papulopustular acne. She's got a lot of the erythema. She's got full cheeks, chin, forehead involvement. And then over here, all you've got left after the treatment, fifth treatment, is just some minor erythema in the cheeks and nose, a little bit of erythema on the chin and forehead. None of the stark redness. As I like to tell people, this can all be covered up with just a little bit of makeup at this point here after the treatment. So they're not back to having that porcelain skin that they had when they were 12, but it's all stuff that can be covered over. And people are very pleased with those results. Let's take a look at another one here real quick. So this is more moderate to severe. You can see up here on her forehead, more of a cystic type of lesion, papular with a lot of swelling underneath, cystic here, cystic there, really kind of even deforming the curve of her cheek because she's just got so much redness and inflammation. And again, here, these are the kind of results that we are seeing. Now, somebody like that, you may want to augment it with a little bit of an antibiotic up front if they're okay with that. If they're not, you can go straight laser, and I think you'd have excellent results on her as well. This is a real severe acne case here. This is the type of thing that if you didn't have a laser at your disposal, you're almost obligated to talk about Accutane. You've got serious scarring, major indentations here, sort of that ice pick scarring, very sad, very hard for the patient. Here you can see not only is the acne gone, but you're getting that rebuilding of collagen here to really reestablish her pores and really reestablish a nice smooth skin texture. And that's another thing that we didn't really get into and that I want to touch on real quick is that the laser will go in and it will stimulate the body to start producing more collagen. And so you're getting in there, and over time, even over the process of 6 months, the body continues to make more collagen. And so she's going to continue to see improved results over here. That's why you can use it for the facial rejuvenation in patients, because it does help with increasing collagen production. This one's only after 5 treatments. Excellent result. And she may need some touch-ups along the way. Somebody that's got this bad of acne, it's very possible that they're going to continue to have some minor breakouts over time. And that's a point to touch on real quick. I never, ever tell people that this is a permanent solution to their acne problem. Not even Accutane is permanent. Accutane has a 50% recurrence rate after a 6-month course. So you cannot tell people that this is a permanent treatment, because acne is a chronic, potentially recurring condition. So it's important to set that expectation that they may need quarterly touch-ups, where we're going to hit a little, if they have any active lesions, we're going to hit those. We're going to continue to freshen up their skin to help continue that remodeling and that regeneration of collagen, and to help with the erythema, that redness that she still has a little bit of. So I prep people that they're going to have an initial course of somewhere between 4 to 8 treatments with probably quarterly touch-ups where we give a reduced rate, usually about 100 to 150, depending on how many lesions they have at those quarterly follow-ups. And now some people are going to be lucky and they're not going to need any quarterly follow-ups. They may be completely clear for 2 years. And if that's the case, then good for them. But if not, then by golly, you know what to do for them. I've had a couple like this. This is severe, severe nodular cystic acne. And you can see, deforming again, very likely that Accutane in the past would have been the only option for her. But you can see here, she's gotten clear. She is left with scarring, which is completely understandable considering the condition that she had. But again, she doesn't have the redness that you see over here on the before slide. Now she's got a little minor erythema. I'm thinking of a patient that I saw today, actually, who has this similar pattern after we got her clear. And then we worked on her for scar treatment as well. So excellent result here, life-changing result, really. And I don't say that to be dramatic, but I've had patients that come in and they can barely look you in the eye when they have acne this bad. And when they're done, they just look like a new person. So it's really rewarding, actually. So moving on. Again, very severe. Wow, that's only after 3 treatments. Really impressive result there. Kind of hitting the same level of serious acne with that erythema. And then here a little bit more mild, comedonal, pustular, getting in good, doing great there after 2 treatments. So that brings me to make sure that I like to tell people you're most likely not going to see anything after the first treatment, but you may really start to see some good improvement after the second or third. Usually people don't get worse. We've had a couple people get worse after the first treatment. So I like to tell people in our literature that they can get worse. Most people don't, but I like to tell people they can. But here you can see that only after 2 treatments, that's already a very impressive result, already making him feel better about life. And we worked on a patient today, an African-American patient that has pseudofolliculitis barbae, PFB, which is essentially a chronic inflammatory condition in the beard and hairline where the hair follicles coil into the skin and cause a tremendous amount of inflammation. And most lasers would not be able to perform this on a person with skin of color because you would have issues with hypopigmentation. But our laser is capable of doing it. Today was his second treatment. We compared pictures from the first to the second. This is not my patient, but it brought that up to mind. They'd already made a great improvement after 1 treatment, and we're really excited. So yes, you can use it on skin of color, which is very unusual for lasers to be able to be used safely in skin of color. And here she's having a nice response. You see that decreased pigmentation there, decreased scarring. Still some activity over here, but way better. Second treatment there. She's doing great. Same thing here. This is after the 3rd treatment. So nice results, really impressive. And that brings me to a thought that they do some excellent training. The literature is incredibly simple to understand. When you're getting ready to get set up to treat a patient, you get their skin type, look over at what you're going to do for them, and it basically is foolproof. And that's something I want to touch on real quick, that one of the reasons I had avoided lasers before was, frankly, they just made me nervous. I didn't want to burn anybody. I didn't want to completely mess somebody up. I didn't want to scar anybody, and I certainly didn't want to get sued. So the thing about this laser is its safety profile is unlike any other in the industry. The microsecond, this super short pulse duration basically makes it to where it's not going to burn the skin. If you follow the directions, which are incredibly simple, it is not going to burn the skin. So something I just wanted to point out there real quick. Acne is serious. People get depressed when they have acne. Adults are depressed when they have acne. It is not just a cosmetic issue. The treatments out there all have side effects. Antibiotics have side effects. They have resistance issues. They can harm your GI flora. And people are really into that GI business these days. So that's a big deal to people. And then, as I mentioned before, females can get yeast infections, and there's just a lot. Then the antibiotics can interfere with birth control. So there's just a lot of issues out there. And of course, we don't even need to get into Accutane. Again, if you Google Accutane side effects, I think a picture of the devil pops up, and it makes it look like the Accutane is going to strangle your patient and kill them. So we all know that's not true, but people are scared to death. So anyway, compliance is always an issue. Whether a teenager's going to take their medication every day, are they going to put their cream on twice a day? With the laser, you don't have to worry about compliance. And then, of course, with insurance, everybody knows how much more is out of pocket these days. And when you're asking people to invest $1,000 to $1,500 for their acne or their kids' acne, they're typically going to be willing to do it if they have really any resources at all. We like to kind of get after it pretty quickly. I like to have people come in every 2 weeks or so at first for the first 2 or 3 treatments, so they can start to see a result quickly. You don't want to do it so fast that there's no time for the healing to take place and for things to get better. But I think if you're in that 2 to 3 week window for the first few treatments, first 2 or 3 treatments, you're going to start to see results pretty quick.